I'm not going to go over all these statistics, but I will tell you that lung cancer is certainly the leading cause of cancer-related deaths. And some people actually say if you add up breast, prostate, colon, and ovarian, that's about equal to, and those are the people who have died of those diseases, that's about equal to the number of people who die of lung cancer. So it's clearly a very major problem. And there's a lot of people who are dying of it, and there's a very large healthcare cost associated with it. So, and that is reflected by the fact that lung cancer is a bad disease to have. It's a lot worse than a lot of these other tumors which are very common. For instance, this is the number of patients who have the disease who have survived for 5 years after that diagnosis. And you can see that lung cancer is only 15%. And compare that to prostate cancer, which is 98%. So the goal, and this would be a great application for screening, the goal would be let's try to catch these lung cancers when they're much earlier stage, and hopefully at a much more treatable stage. But hopefully if we catch them early, we're able to prevent that 15% and make that number, the number of people who survive that 5 years after diagnosis, a lot higher.